Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Today, inshallah, I am going to introduce an interesting topic about the predictive power, AI's value in clinical practice and research. This presentation will explore the transformative potential of artificial intelligence in healthcare and research. AI's predictive capabilities are setting a new paradigm for clinical practice, enhancing early diagnosis, risk assessment, and personalized treatment strategies. We will explore together how AI could revolutionize the field, offering a forward-looking approach to proactive and preventive care. This is Muhammad Hassanin. I am a professor of clinical biochemistry and a senior fellow at Advanced HE UK. I have a joint master of health profession education from Suez Canal and Maastricht University, a CMCL Femur Fellowship in health profession education, a master in e-learning from Illinois University, master in leading innovation and change from York City University in UK. The final and for today, a certificate of data science and machine learning from MIT USA. The main aim today is to introduce and just to open the door for the transformative potential of AI's predictive capabilities in reshaping healthcare and research and setting a new paradigm for clinical practice. Let's start by three important definitions and terms. The first one is artificial intelligence, which refers to the simulation of human intelligence in machines that perform tasks requiring human intelligence, such as learning, problem solving, and decision making, and moreover, for other special sense like seeing, hearing, speaking, even smelling, and some motor activity like we see and watch in robot in surgery, for example. While machine learning is a subset of AI focused on developing algorithms and statistical models that enable computers to learn from data without being explicitly programmed. The last but not least is deep learning. Deep learning as a subset from machine learning that focus on the development of and training of artificial neural network with multiple layers. These networks are capable of learning target patterns and the representation from complex data. Actually, machine learning and deep learning are the main player for using AI in healthcare, especially for prediction and forecasting. This image summarizes what I just mentioned, that the big umbrella is artificial intelligence, which imitates the human intelligence and behavior. Machine learning, which is the subset of it based on algorithm and some statistical models. Deep learning, the last and the subset of machine learning, which is based on neural network like that of the human brain. Let's just introduce also ChatGPT. ChatGPT is a state of art from the three package. It is artificial intelligence based on machine learning and deep learning using transformer model, and is called one of the generative AI techniques. This image also summarizes what can AI do. As we mentioned, cognitive, all cognitive function, then special sense, then the motor part for physical and psychomotor activity. We have three types of machine learning. Supervised learning, which is based on classified or labeled data and used for prediction and decision. Unsupervised, which use unlabeled data. The best example is that in email, which classify email to cluster spam and not spam. The last type is reinforcement learning, is a machine learning which learn from mistake and make reinforcement and recorrect based on trial and error. Now, what is the role of AI in healthcare? Actually, you have four main roles: analyze vast data, predictive analysis in healthcare, impact on research, and a look to the future. For data, it could anticipate health outcomes, identify risk factor, personalize treatment plan, improve patient care and the outcomes, and these ultimate outcomes from analyzing data. For predictive, it could shift from reactive to proactive or preventive intervention. by predicting disease onset, treatment response, and the potential complication. And for research, it accelerates discovery of novel therapies, uncover insight into pediatric disease and other disease, inform target interventions, and in the future, we have unveiled new possibilities for early detection, advanced precision medicine, enhanced data-driven decision making in pediatric healthcare, and all other aspects of healthcare. Let's start by the predictive value. And by the way, this image I generate, not me, artificial intelligence generates this image by writing certain prompt to give this nice image. Okay, so the predictive value. Through analysis, bring a forward-looking approach to healthcare, moving point reactive treatment to proactive and preventive care, as we mentioned, tailored to individual's unique health profile. Using this predictive analytics in clinical practice in two dimensions. The first one is to revolutionizing diagnosis. In clinical setting, AI predictive models are revolutionizing early diagnosis, risk assessment, and personalized treatment strategies, significantly enhancing patient outcome. And for the preventive intervention, AI predicts the likelihood of disease progression in chronic condition, enabling preventive interventions that can alter a patient health trajectory. Regarding research, we have also two dimensions. The first one is uncovering pattern. In research, AI shift through vast data set, uncovering pattern and insights that accelerate discovery of novel therapies and deepen our understanding of complex disease. Also, this could expediting treatments through AI-driven research is not only expediting the path to groundbreaking treatment, but also paving the way for more targeted and effective clinical trials. Let's see some example or rare example of research which is done for early detection of, for the first example, autism spectrum disorder. What is the challenge? And you know more than me about it. Autism spectrum disorder represents a significant diagnostic challenge due to their diverse manifestation and the need for early intervention. What AI can do, utilizing advanced algorithms, AI analyze a combination of genetic marker, behavior pattern, even facial expression to identify early signs of ASD. What is the outcomes? This approach has led to identification of ASD marker in children as young as 18 months, significantly earlier than the traditional method. And this is an example of recently published paper, machine learning based model for early stages detection of autism spectrum disorder. Another example is predicting sepsis in neonate. What is the problem? Neonatal sepsis, a critical condition with high mortality rates requiring rapid diagnosis and treatment. What had a solution done for it? AI models analyze real-time data from multiple sources to predict the onset of sepsis in neonate up to 48 hours before clinical symptoms manifest. What is the impact of this? The implementation of AI in predicting neonatal sepsis has resulted in timely and precise interventions, improving survival rates in neonatal intensive care units. And this is another recently published paper about a predictive model based on machine learning for early detection of late onset neonatal sepsis development and observational study. The last study is about treatment of pediatric acute lymphocytic leukemia. What is the challenge? Pediatric acute lymphocytic leukemia poses a treatment challenge due to diverse response to chemotherapy among patients. What's the role of predictive AI? AI algorithms analyze genetic data, treatment outcomes to predict individual response to chemotherapy, enabling customization of treatment plan. What is the result? This tailored approach, guided by AI prediction, has a significantly improved remission rates and reduced the incidence of relapse in pediatric acute lymphocytic leukemia patients. And this is the third paper, which is machine learning application for prediction of relapse in childhood acute lymphocytic leukemia, also recently published. Go to the second item in this presentation about harnessing clinical data with AI. For a vast data we have in electronic health record or in our hospital or our clinics, AI can have also four domains. The first one, comprehensive data integration, consolidate diverse clinical data sources from electronic health record, genetic information, real-time monitoring, which will offer a holistic view of a person's health. Number two, pattern recognition and analysis. Identify complex pattern within a large data set through advanced algorithms. This will uncover insight to guide clinical decision and interventions. The third, predictive insight for proactive care. Provide a predictive insight leveraging data which will enable healthcare providers to anticipate and address potential health issues. The fourth, tailored treatment strategies through facilitation of the development of personalized treatment plans. This will ensure each patient will receive the most effective care tailored to their specific needs. Also, using the data could help to forecast, like the weather forecast, with machine learning in healthcare. Through also predictive analytic defined through utilizing machine learning to analyze historical and real-time data, forecasting future health events and outcomes. Machine learning in action will learn from vast amount of data, identifying pattern and trend, which you can predict health conditions like asthma exacerbation, diabetic episodes, or complication in chronic disease. We have an example about asthma prediction. AI predict asthma flare-ups by analyzing factors such as medical history, environmental data, and real-time symptoms. This will allow for preventive management and treatment adjustment. Also, this will have an impact on patient care through empowering healthcare professionals to adopt a proactive approach and significantly improves patient outcomes by preventing adverse events and optimizing treatment efficiency. The last aspect of this is tailoring treatment plan. Through individualized treatment approach, AI analyzed patient data, as we mentioned, genetic information, medical history, lifestyle factor to create personalized treatment plan. So the previous was on large scale, now on just personalized patient. For example, in oncology, AI use genetic profiling to determine effective chemotherapy regimen individualized, so it will reduce risk of adverse effect and increase treatment success rate. Also, in chronic condition management, AI predict blood sugar trend in juvenile diabetes and recommend insulin adjustment, and this is also for type 2 diabetes. This will provide personalized management plan accommodating daily variability. The last but not least, this will enhance quality of life by improving clinical outcomes and enhance quality of life for pediatric patients and to all aspects of disease. This will make treatment less burdensome and more effective at nationwide or at the level of the population. Now, are there any AI application already invented or there for healthcare service? I just go through some example to some application which already there. First one, iDoc. iDoc provide radiologists with advanced medical imaging analysis, and even it could give the report, which just need validation and verification from consultant or specialist. We have Butterfly Network. Butterfly offer ultrasound with a probe is just connected to the mobile and could be connected to a team of physicians. SenseCare is a smart health platform with high performance diagnostic and treatment assistant, also based on AI algorithm, based also in image post processing technology. Bus AI, which is related to histopathology and the diagnosis of histopathology smears and image, and could assist pathologists in disease detection and diagnosis. Alive Core Cardio in cardiology and ECGs is a lot of applications. Is one of them which you can detect atrial fibrillation, bradycardia, tachycardia, and normal heart rhythm. With AI, it is like that of ultrasound, but is a Doppler for blood vessel occlusion and critical brain event, and coordinate all of this to care to expedite treatment. Once Dragon Medical, it is another voice recognition software which could help physician to quickly document patient care. Analytics leverage deep learning to assist the radiologist to interpret X-ray, MRI, and CT like the first one. Cloud Medics offer a clinical AI platform to generate insight differential diagnosis for clinical decision. Blue Dot also analyze various data sources to track and predict infectious disease outbreak. Let's explore in the last section of this presentation a machine learning model which I developed for predicting diabetes mellitus among pregnant women. This model was trained on a vast amount of data about pregnant women, including a data set that include a number of pregnancy, blood glucose level, blood pressure, skin thickness, insulin level, diabetes pedigree, and age. Once I give the model a new data include these parameters, it will predict the likelihood and the outcome of getting diabetes. So this is a GPT I developed using ChatGPT. So in just a few seconds, I'll get it after training the model. I'll ask it predict the outcome and likelihood to develop diabetes. Once I give it this prompt, it will ask me to give these parameters. So it asks me to give it all these parameters. I'll copy it and put it in the new prompt and give it empirical data like number of pregnancy, say 3, glucose level 132, blood pressure, which is the diastolic 77, for example, skin thickness 35, insulin level 72, body mass index 32.6, diabetes pedigree 0.654. Okay, age 50. Then enter. It will analyze this data in relation to the data set it have and the model which I already developed it using it. And by the same way, we can develop many models based on a data set we have for different disease. So based on the provided information, the model predicts that the new patient doesn't have diabetes, outcome 0, with a likelihood 48. This prediction suggests that the patient is on the borderline of being at risk. It also evaluates the model. It is important to note that the model accuracy based on the test is approximately 67, which is good for machine learning model, by the way. This actually includes the model general performance, but doesn't guarantee the precision of individual prediction. For comprehensive assessment, a medical professional evaluation is recommended. And this is important point that any data we can get from any model needs to be correlated with the clinical data. The code in this model, it gives us the analysis and the code it used to calculate or to give us this prediction and outcome. So this was the last section in this session. So looking ahead, AI will revolutionize healthcare by enhancing diagnostic accuracy and enabling proactive intervention. But we have a challenge. The integration of AI in healthcare will come with a challenge such as data privacy concern and the need for robust infrastructure. And I hope we will discuss this in the answer and the questions and answer. The future potential of AI in healthcare is immense, with the ability to make care more precise, accessible, and equitable. In conclusion, AI impact on healthcare is profound, improving patient outcomes and personalizing treatment plan. As we look to the future, the collaboration and the ethical use of AI will be paramount to ensure the best outcomes for all patients. Together, we can shape a future where every patient can receive personalized, proactive, and compassionate health care. Any questions? I am ready, inshallah. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.